What have you learned at HM19 that you're going to apply in your day-to-day practice?
Well, there's so much that I have learned. This time around, I did more clinical. So I did the updates in heart failure, which that speaker was awesome. He actually made pathophysiology kind of interesting.
Okay.
Yeah, so, but I'm going to apply a lot of what I've learned in regard to just the clinical updates. I mean, that's really why I came this time, was to hear what are the updates in sepsis, what are the updates in heart failure. I'm going to go to the one in pneumonia here in a few minutes. So just hoping to apply all of those updates so that I am the best hospitalist I can be for my patient.
So what would you say is the best session that you went to?
Well, actually, even though I'm here for the clinical updates, the session that we just came out of on burnout was so applicable and really resonated with me. As a hospitalist, I'm also a medical director for my group, and so burnout is so important, making sure that my group feels that they're valuable to my team, that we collaborate together, because every single person on my team, whether they're the hospitalist or they're the administrator, or even our office coordinators, are so important to my team, and just trying to make sure I take care of them, make them feel valued, and that their well-being is just as important as what they bring clinical to the team.
And what's one way that you can make them feel valued that you learned from the session?
A lot of it is just checking in with them and making sure that we communicate with one another instead of kind of going to our own corners, going to our own offices and doing our work on our own. Really making sure that we spend time with each other, even if it's just eating lunch together. I almost equate it to the family dinner, that when you don't see each other all week, but then you make sure you come together for family dinner. That's kind of how I see really showing my team that they're valued, is bringing them together, just kind of hearing what's going on, not just for work, but in their personal lives, and really wanting to invest in them.
What have you learned at HM19 that you'd like to use in your day-to-day practice?
So I attended a wonderful session. It was a clinical rapid fire session that was on antibiotics made ridiculously simple. And I really enjoyed how the doctor organized antibiotics. So I'm going to take that back and use that as I'm teaching my residents and students how to organize antibiotics simply.
Okay, and would you say that's the best session you attended?
It was a really good session. It was one that was interesting and different. I've attended a lot of really good sessions. The plenary was awesome. I've attended a workshop that was really helpful. I think that just stands out to me, something that I'm going to definitely use when I go back home.
Okay, and what was the workshop that was awesome?
The workshop was actually a workshop on how to give a workshop.
Okay.
So it was done by some fabulous faculty. It was a really engaging session, and for me, as someone who does a fair amount of workshops, there were actually some new things that I'm going to use when I do my next workshop.
Awesome. And what would bring you out to HM20 in San Diego next year?
Besides the sunshine and the beautiful city? So I really enjoy, so I'm a pediatrician, I'm a pediatric hospitalist, and our pediatric track, I think, every year has just become stronger and stronger. So I'm going to be looking for the content that we have next year. I'm looking for high-impact clinical topics, things like this year we did sepsis, which was great, very topical. And then for me, it's always about the breadth of hospital medicine, so the practice management pearls, the education, the QI. Those are the things I'm going to be looking for next year, and I'm sure that SHM will continue to build on what we have this year.
What have you learned at HM19 that you'll apply in your day-to-day practice?
Well, I have so far attended the clinical updates, and I have learned a little bit things about the COPD and the pneumonia, which I think I'm definitely going to apply in my practice, day-to-day practice back in Texas.
And what was your favorite session that you've attended?
I think it was regarding the severe sepsis, in which they talk about whether or not to use the steroids. That was really a controversial subject, which we almost always discuss when in the ICU, in our attendings. I think it's a still ongoing debate, and I will see where this thing, we see maybe in the next year in 2020, when what are the new updates about that. It's all still a controversial topic.
So what would get you really excited about HM20 in San Diego?
I started, coming into SHM last year. I was really very excited when I learned about all these. See my colleagues are all around, so it's a very good social platform where you feel like you've been heard, and all your questions you had about yourself, about your practice, being answered here. So I think every year I learn something new, and it gives me a track about my hospice program, like what am I going to do, what are my future goals, what are my future aspirations. So in all the perspective, all the hospital's perspective. So I think it creates a lot of info for me and a lot of situations, scenarios where I can work. Even here, like in the exhibit hall, learning about what's going on in the industry. And just everywhere there's information and there's knowledge and things that you can learn and adapt.
What have you learned at HM19 that you'll apply in your day-to-day practice?
I really took a lot from the onboarding process as I work as a lead APC in our hospitalist practice. And it gave us a good insight on the importance of good onboarding of our clinicians, which leads to better clinician engagement and retention.
And what would bring you out to San Diego next year?
I think I've been to SHM. This is my third in a row. I plan on going next year. I think that the talks are very intuitive, and as a PA, they're really starting to notice that we're a big part of hospital medicine, and I'm real interested to see how the practice evolves using NPs and PAs.
So what have you learned at HM19 that you're going to apply in your day-to-day practice?
So far the meeting has been very vibrant. I especially like the keynote speech, Dr. Mark Harrison, and leading into that was the president's speech as well, Nassim Afsar. And the fact that we were currently in a very rapidly changing healthcare environment, being impacted by so many different things. There's a lot of new players in healthcare, and so the biggest take-home message from that was that change is constant, and we have to embrace it and be able to adapt, to be able to survive, and to do what's really best for the patients that we serve. So that's my biggest takeaway so far.
Okay.
Yeah.
And what was the best session you've attended and why?
So the best session I've attended, again, has to do with leadership. I attended the adaptive leadership session yesterday. We delved into issues around emotional intelligence and team dynamics and how that plays a role in how we engage ourselves, managing peers, and then managing up with the C-suite and everybody that has a key role to play in the hospital setting. So ultimately, we ended up that session talking about diversity and how that also plays a role in developing our teams and creating an open space for everybody, an inclusive space, appreciating people's diversity, and taking that a step forward, and accommodating people's needs with a sense of fairness.
And what would bring you out to San Diego next year for HM20?
I always look forward to the keynote speeches. A lot of times it's driven by what's happening in healthcare. So, coming to SHM, you have these very influential leaders, very forward-thinking leaders to inspire us to do the things that we need to do when we get back to our places of practice.
What have you learned at HM19 that you'll apply in your day-to-day practice?
So I just attended a physician's burnout session on physician's burnout, and that was a really great talk. And I think the main point that I took from that is basically getting involved, making sure that your voices are heard, and participating in committees and making sure that leadership is, you get involved in leadership essentially. That's what I learned from that. So coming to SHM in general, it gives you a lot of opportunities to kind of share ideas with lots of hospitals from various practice settings. So those are the things that I look forward to every time I come to SHM.
Awesome. And what would bring you out to San Diego next year for HM20?
Oh my gosh, lots of reasons. Again, connection, making meeting people, like I said, sharing ideas, and I think this is a really great environment, a very relaxed environment where you can learn a lot. These kind of opportunities are limited, so physicians are very busy, so this gives us a really great opportunity and platform to just connect with people and learn in a very relaxed environment.
What have you learned at HM19 that you'll apply in your day-to-day practice?
Some updated clinical guidelines, like when to initiate non-statin therapy for patients that to still lower their LDL, and some additional heart failure guidelines and new antibiotics stuff from the lecture that we talked to yesterday.
Okay. And what was the best session that you attended?
I thought a lot of them were good so far. My favorite probably was the updates on the acute coronary syndrome, just because of there was some good information, like I just mentioned, and then also it was comical and interactive and exciting.
Do you find that there are a lot of good resources for PAs?
Yeah. So far it's there's a little bit more towards the end of the conference, but even yesterday they had a couple informative. There was a meeting later in the day, and every session can be dictated towards any clinician.
Okay, and what would bring you out to San Diego next year?
The weather.